What if the most dangerous moment of your surgery has nothing to do with the surgeon's hands? What if it happens hours later when everyone thinks the hard part is over? You go in trusting the process. You come out, and something feels different. Not the pain you expected, something else. Stay with me, because what I'm about to share could change how you walk into your next operation. I'm Dr. Christian O'Brien. I've spent over 15 years in clinical practice focused on metabolic and preventive health, and I have sat across from too many families who were blindsided by a recovery that didn't go the way anyone promised. This is not about scaring you away from surgery. It's about making sure you walk in with your eyes open. Picture someone you know. Maybe it's your own mother. Maybe it's the man next door who mows his lawn every Saturday like clockwork. He's 68. Healthy enough, he thinks. He needs a hip replaced. Nothing dramatic, just routine these days. He goes in confident. He comes out 3 days later, and he's not himself. He's confused about where he is. He doesn't recognize his own daughter for a few hours. The family is terrified, thinking the worst. Here's the part almost nobody tells you before you sign that consent form. Your body after 50 does not respond to surgery and anesthesia the same way it did at 30. That's not me being dramatic. That's just biology catching up with the calendar. And once you understand why, you stop feeling helpless about it. You start feeling prepared. Let's talk about what's actually happening inside you, because once you see it clearly, none of this feels scary anymore. It just feels like information you should have had all along. Think about your home's plumbing system after 20, 30 years of use. The pipes still work. Water still comes out when you turn the faucet, but the flow isn't quite what it used to be. There's a little more resistance, a little more buildup along the walls. Your blood vessels age in a similar way. They get a bit stiffer, a bit narrower in places. So when anesthesia drugs go into your bloodstream, they don't move through your system, and they don't clear out of your system, the same way they did when you were younger. This matters more than most people realize. Researchers looking specifically at anesthesia complications in patients over 65 found that cardiovascular events were the single most common complication during these procedures, followed by breathing problems and reactions to medication. That's not a reason to panic. It's a reason to ask your doctor specific questions before you ever get near the operating room. Ask what your anesthesia team is doing differently because of your age. A good team already has an answer ready. If they don't, that itself tells you something. I want you to remember one phrase because you're going to hear it again before this video ends, and it might be the single most useful pair of words you take away today. Postoperative delirium. It sounds clinical, I know. Let me make it simple. Think about jet lag, the kind where you land in a new time zone, and your brain just cannot figure out what time it actually is. You're foggy. You say things that don't quite make sense. You forget where you put your glasses, even though they're on your face. Postoperative delirium is something like that, except it's caused by the stress of surgery and the lingering effects of anesthesia on an aging brain, and it can show up suddenly, sometimes the very same day as the operation. Medical organizations that focus specifically on aging and surgery, including the American College of Surgeons and the American Geriatrics Society, have identified this as one of the most important risks to watch for in surgical patients over 65. It's common enough that hospitals are now building entire protocols just to catch it early and manage it well. Here is your actionable takeaway, the one you can use starting with your very next doctor's visit. Ask directly whether the hospital or surgical center has any kind of geriatric assessment program in place. Some hospitals have actually earned a special verification through the American College of Surgeons, specifically for how well they care for older surgical patients. If yours has that, that's a genuinely good sign. If they've never heard the term, that's worth a follow-up question too. I know some of you are tempted to skip ahead right now thinking you've heard enough to feel cautious. Please don't, because the next part is the one piece of information that, if your own doctor never mentioned it to you, could change how you prepare for any procedure coming up in your life. Before we get to that, let me take 15 seconds. If you've found this helpful so far, all I ask is that you stick around, because this channel exists for one reason: to give you the kind of plain-spoken information your 15-minute office visit usually doesn't have time for. All right, back to it. There's a word your surgical team might use that sounds almost insulting if you don't understand it. Frailty. Nobody wants to hear that word applied to themselves. But here's the thing. Frailty in medicine doesn't mean weak or fragile in the way we use it in conversation. It's a specific, measurable condition. Things like how fast you can walk a short distance, how much muscle strength you have in your grip, whether you've lost weight without trying to. Think of it like a car's odometer combined with an inspection report. Two cars can be the same model year, but one has been driven carefully and maintained well, and the other has been through rough roads with skipped oil changes. Age alone doesn't tell the whole story. Condition does. This is genuinely important, so let me say it plainly. Studies looking at surgical outcomes have found that frailty predicts how someone will do after surgery better than their age on the birth certificate ever could. Two people can both be 73 years old. One sails through a procedure and is back gardening within weeks. The other struggles for months. The difference often comes down to this measurable condition of frailty, not the number of birthdays. So what do you actually do with this? You ask your doctor, in plain language, whether anyone has assessed your frailty before recommending surgery, not just your age and your diagnosis. The American College of Surgeons and the American Geriatrics Society have specifically recommended that this kind of assessment happen before major procedures in older patients. If nobody has brought it up, you have every right to bring it up yourself. You are allowed to ask questions. You are allowed to ask for a second opinion. No good surgeon will ever be offended by that. Let me tell you about someone who came through a clinic I worked closely with, and I want to be honest with you, I'm sharing this as a composite example. The kind of story I've seen play out in slightly different versions many times over the years, not a single specific patient file. We'll call her Dorothy. She was 69, scheduled for a knee replacement, and like a lot of people her age, she was on several medications for blood pressure and for sleep. Nobody had sat down and specifically reviewed how those medications might interact with anesthesia, and nobody had assessed her for frailty beyond glancing at her chart. Her daughter, who happened to work in healthcare administration, asked the surgical team directly about a frailty assessment and a medication review before the date was confirmed. The team adjusted her blood pressure medication timing around the surgery and flagged her as someone who needed closer monitoring for confusion afterward. Dorothy went through her surgery, had a brief period of mild disorientation the first night, which the nursing staff was already watching for and managed quickly, and was walking with assistance within 2 days. The point isn't that her story is unique, it's that asking the right questions ahead of time changed how her care team prepared for her, and that preparation is something every single one of you watching can ask for too. This is why these conversations matter so much before you ever get to the hospital, not after. Now I want to walk you through what I'd call your personal checklist, the questions worth asking before agreeing to any major procedure, especially once you're past 50. Think of this less like a warning and more like a toolbox. You don't need every tool for every job, but you want to know they're available to you. First, ask about anesthesia type. Regional anesthesia, the kind that numbs a specific area rather than putting your whole body to sleep, has been associated in some research with fewer breathing complications afterward compared to general anesthesia, particularly for certain procedures. It's not right for every surgery, but it's worth asking whether it's an option for yours. Second, ask about your medication list specifically in relation to the surgery. Many older adults are on multiple medications, and a proper review before surgery can catch interactions that might otherwise go unnoticed until it's too late to easily fix them. Third, ask whether a frailty or functional assessment has been done, not just a general physical. We've already talked about why this matters more than age alone. Fourth, and this one surprises people, ask about your nutrition and your mobility leading up to the surgery date. Guidelines for older surgical patients specifically flag nutritional status and mobility as factors worth addressing before the operation, not after. Something as simple as protein intake and short daily walks in the weeks beforehand can genuinely support a smoother recovery. And the question I'd put right at the top, the one I think matters most of all. Ask who on the surgical team is specifically responsible for watching for confusion or delirium in the days right after surgery, and what their plan is if it happens. This single question tells you more about how seriously a surgical team takes older patients than almost anything else you could ask. If you only remember one thing from everything we've covered today, let it be this question. I want to pause here and say something directly, because it matters. Nothing in this video is meant to replace an actual conversation with your own doctor, who knows your specific health history, your medications, and your particular situation far better than any video ever could. Use what you've learned here as a way to have a better conversation with them, not as a replacement for one. Here's what I want you to walk away with today. Surgery after 50 is not something to fear blindly, and it's not something to walk into blindly either. The body changes with age in real, measurable ways. The way the plumbing in an older home changes. The way an engine running for decades needs a different kind of attention than a brand new one. Postoperative delirium is real. Frailty matters more than your age on paper. Your medications deserve a careful second look before any procedure, and the right hospital team will welcome every single question you bring to them. You decide how prepared you walk into that pre-op room. You decide whether you ask the question about delirium monitoring, whether you ask about a frailty assessment, whether you ask for a second opinion when something doesn't sit right with you. That's not me being preachy. That's just the truth about how much control you actually have here. More than most people realize until they exercise it. If someone in your life has a surgery coming up, a parent, a spouse, a close friend, send them this video today. Not because I need the views, but because the right question asked at the right time, before that consent form gets signed, can genuinely change how their recovery goes. That's worth more than almost anything else you could give them this week. If this kind of straightforward, no-nonsense health information is something you want more of, go ahead and subscribe. I'll keep bringing you exactly this, the things your 15-minute appointment rarely has time to cover. Next time, we're going to talk about a quiet warning sign your body gives you months before a heart problem ever shows up on a test, and almost nobody knows to look for it. I'm Dr. Christian O'Brien, and I'll see you in the next one. Take care of yourself.